Welcome back, folks. In the last 20 years, disability from back and neck pain has increased by 54%. Annual health care costs associated with back pain exceeds $50 billion. These costs rise to more than $100 billion when you include lost wages and decreased productivity. Now, if you're part of the 80% of the population suffering from back pain, Dr. Glenn Pinto joins us now with some advice that could put your life back on track. All right, Dr. Pinto, let's talk about this. I love when you come here because you really do kind of put people at ease when if they're fearful of pain, but talk about some of the typical, now we're not typical complaints, but I want to first get to you. And when you talk about your 30 years in practice, you've been doing this a long time.
I have.
What has changed? What have you seen, the changes that you've seen over that years?
Well, what I see is 30 years ago, stress levels and injuries were much simpler in the lower level. Nowadays, stress levels are so much higher. Injuries are so much more profound. People have all these deficiencies in chronic pain. So you really need to not only have a higher level of diagnostic skills to figure out what's wrong with people, but also in treating them too.
No, absolutely. That does lead me to really what I love talking to you about, and that is the typical complaints you hear from patients, because I'm sure you've heard it all.
Right. Well, if anybody is asked, well, what's a chiropractor do? We treat neck and back pain. Of course we do. And years ago, it was a lot simpler. A couple of weeks and they're done. Nowadays, the injuries have progressed to a point where people have severe low back pain, chronic sciatica, numbness, tingling, migraines, and it starts to ruin their lives. They can't play with their kids, they can't work, and it just kind of takes a lot of the fun out of their lives.
No, absolutely.
Yeah.
Chronic pain is no fun, but the patients that have come and seen you have experienced so much success. We're going to go ahead and listen to some of them.
Sure.
I was having severe acute intermittent pain, like a 10-inch needle being shoved into my lower back.
It was just a pinching. I had it running through my leg all the way to my toes.
I woke up one morning and I literally couldn't move. I couldn't get off the floor.
It was debilitating at moments.
Even now I have a 6-month-old. I couldn't lift her.
I couldn't move my hand. Everything was numb. I was out of work.
I did physical therapy, even surgery.
I tried acupuncture, a few other things. It just wasn't working. And so I called Dr. Pinto. Everybody knows he's the best in the business. And I'm like, help.
I loved immediately how he didn't do anything until he took an x-ray. He wanted to know what was going on.
His initial was, come bring me the MRIs and then we'll see if you're a candidate for the treatment. And I was.
In just a few short weeks, I can function again. I'm back to adjusting patients and functioning as a mother, because that's the biggest job that there is.
I feel very fortunate that if you work hard and follow the program, it works.
It's just made my whole life better.
I would absolutely recommend Dr. Pinto and his team. They're amazing. The staff is great.
Everything he does is to make you better.
I would recommend him to anybody, and I believe wholeheartedly in the system.
Dr. Pinto is the chiropractor's chiropractor.
When you hear them speaking, anyone can hear that obviously you have a great skill and talent at diagnosing problems. How do you do that?
Well, we take a history, we do a thorough examination, we can take some really clear, concise digital x-rays in the office, and if need be, most of the time we'll order an MRI on people. Most of the injuries that we see involve discs, either herniations or bulges. The MRI is the gold standard for diagnosing that stuff. When discs bulge, they put pressure on nerves and they cause more severe back pain, and so that it just makes it more accurate to diagnose it.
What can you explain a little bit about what some of the things people have done prior to coming to your office? I'm sure they've tried to, fix themselves or go places that maybe just didn't do the trick, right?
You can probably guess that. They take in the over-the-counter medications. They buy the big bottle from Costco, which has side effects, but it's cheap. They've tried more severe, more powerful pain medications or anti-inflammatories, even done epidural steroids, which a lot of times, if they're lucky, it'll give them temporary relief, and a lot of times patients come and they've even been told that they need surgery too, to have their back fused, which is a little aggressive.
Talk about the DRX 9000. This is something that definitely helps your patients relieve some of that pain.
Sure, it's really quite simple. It's been around for almost 2 decades, and it causes a negative pressure. Basically, we put people on the table, and it pulls and relaxes. It takes about 30 minutes per treatment. It causes a negative pressure, which will feel great. It'll bring the disc back to the center. But even as patients transition to periodic maintenance care, then they can come in just once a month or so just to maintain a higher level. this type of approach is considerably safer than the alternatives, as well as being a lot more time and cost effective.
Well, in addition to getting people out of pain, you also do it in an affordable way. Talk about the great special you have for us.
Sure. Well, they say there's no free lunches, but I do offer, a complimentary consultation. If you've got some x-rays or studies from other doctors, bring them in. We're happy to look things over. I guess the biggest thing is that, procrastination is the thief of health. You put things off that you should do now, and it becomes more severe. And not that there's not a solution for the severe cases, but it's much easier to treat things when they become mild. And obviously, you can help your friends and family if you're feeling better, but also, you want to enjoy your life and you don't want to be a burden and not be able to play with your kids and stuff. So call.
We love it. Dr. Pinto, thank you so much. Call 720-485-6894 for your free consultation at Pinto Chiropractic. That's worth $325. If you're a candidate for treatment and are accepted for care, you'll receive $250 off your treatment plan. This is for the first 20 callers, so call now at 720-485-6894 or learn more. You can visit pintochiropractic.com. They paid for today's segment, and we'll be right back.